my name's Christina and this is my head to toe assessment video. First thing I would do is perform hand hygiene, close the door for patient privacy, and introduce myself to the patient. Hi, my name's Christina and I'll be your nurse today. Can you please verify your name and date of birth?
My name is John Smith and my date of birth is June 16, 1987.
Okay, that would be to patient verifiers. And do you know what month we're in?
We're in the month of March.
And what city are you in?
Rockland.
And what brings you in today?
An annual assessment.
Okay. And are you any pain today?
I am not.
Okay, so patient is alert and oriented ×4. He is a good communicator. He has good hygiene and he's able to sit upright on his own. Next thing I would do is take his vitals, which would include blood pressure, O2 sat, temperature, respiratory rate, and heart rate. So today we're going to be doing a head to toe assessment, which basically we're just going to be assessing from the head down to the toe. So first thing I would want to do is start with your scalp. I just want to go in here and feel for any lumps, bumps, any infestations, any thinning hair, any bleeding, anything like that. Everything looks normal. Next thing we're going to assess is your eyes. Eyes are symmetrical. Pupils are round and similar in shape. And then next thing we're going to do is see how reactive they are to light. So I'm going to go ahead and shine this light into your eye. Okay. Pupils are reactive to light. And I'm going to go ahead and gently look at the underneath of your eye. Okay. The sclera is white and the conjunctiva is pink and moist. Next thing we want to do is assess the nose. The nose is symmetrical midline. I'm going to go ahead and have you tilt your head back. I'm going to go ahead and look inside. Okay. The nares are non-inflammatory. There's no bleeding, no discharge. The septum is midline. And next thing I want you to do is cover one nostril and breathe in and out. And switch and do that for the other side. Okay, nares are patent. Next thing I'm going to do is check your sinuses to see if you have any pain. Do you have any pain on your sinuses when I press down?
No.
Okay. Next thing we want to assess is the mouth. Lips are pink and moist. If you could go ahead and open your mouth and say ah, stick out your tongue. Perfect. Tongue is midline. Uvula the uvula is goes up and down like normal. The oral mucosa is pink and moist. There's no lesions or abrasions or anything like that, or any discoloring of the oral cavity, and the tongue is midline. Next thing we're going to do is assess the ears. So we want to go ahead and look at the front, assess for any skin breakdown. Is that painful at all?
No pain.
Okay, we want to check behind the ear for any skin breakdown. I'm going to check inside the ear for any swelling, bleeding, any excess wax buildup. Okay. I'd also want to be checking the tympanic membrane with an otoscope. Next thing I want to do is assess the lymph nodes. Is there any pain or tenderness when I assess here?
No.
Okay. Okay. We want to check for jugular venous distension, and I don't see any. If you could swallow. Okay. Trachea is midline and swallow is normal, up and down normally. Next thing we want to do is palpate the chest for any tenderness. Does that hurt at all when I press here?
No.
Okay. Okay, next thing we want to do is go ahead and listen to your lungs. So I'm going to have you just breathe normal, and I'm going to go ahead and listen to your lungs. Okay, and if you could sit up, I'm going to go ahead and do that for the anterior posterior side. Okay, lungs are clear in all lobes and no adventitious lung sounds noted. Next thing we are going to do is go ahead and we're going to do the whisper test real quick. So I'm just going to whisper a number and I want you to go ahead and tell me what that number is.
26.
Okay, and then we're also going to do the Snellen eye test. So I'm going to show you this chart. And I want you to tell me, cover one eye and tell me what the top 3 letters are.
EFP.
Okay, go ahead and switch.
EFP.
Okay, perfect. Next thing I want to do is I want to go ahead and listen to your heart. Heart sounds are normal. S1 and S2 are heard. No additional heart sounds or murmurs detected. Next thing I'm going to do is I'm going to have you lay down and I'm going to go ahead and auscultate the bowels. And are you having any trouble using the restroom at all?
No.
Okay. And when was the last time you had a bowel movement?
This morning.
Okay, perfect. I'm going to go ahead and listen to all 4 quadrants of your abdomen. Okay, bowel sounds heard in all 4 quadrants. Abdomen is non-tender and non-distended. I'm going to go ahead and palpate the abdomen. Let me know if you feel any pain while I'm doing this.
Okay.
Any pain at all?
No pain.
Okay, perfect. So the next thing we're going to do is we're going to test your range of motion. So if you could go ahead and sit up for me. Okay, we're going to check your neck range of motion first. If you could look left, look right, look up, look down. Okay, normal full range of motion on neck. Next thing we're going to do is your arms. If you could put your arms up, all the way down. You could put them out to the side, make a circle, small circle. Okay, perfect. Normal range of motion in upper extremities. I'm going to go ahead and do the shrug test. If you could shrug your shoulders. Okay. Good strength in shoulders. If you could put your arms in front of you in fists. We're going to go ahead and test your strength. Push against me, towards me, pull for me, and push. Okay. Good strength in upper extremities. Now we're going to be going to the lower extremities. If you could put your legs up and up in the air. Okay. I'm going to go ahead and push down. Try not to let me push. Okay. Good strength in lower extremities. I'm going to go ahead and check your ankles. Make a circle with your ankle. Okay. Any joint pain or anything like that?
Nope.
In your fingers? Okay, I'm going to go ahead and check your capillary refill on your nail. I'm going to go ahead and pinch it. Okay. Less than 3-second cap refill on both fingernail and toenail. Next thing we want to do is do the Dolen soft test. I'm going to go ahead and use a dull or a soft tip. You let me know which one you feel.
Soft. Sharp. Sharp. Soft.
Okay, perfect. Next thing we're going to do is we're going to have you walk. So if you feel comfortable, stand up. I'm going to go ahead and have you walk a little bit and then walk backwards. Do you use any mobility aids at home?
I don't.
Okay. If you could go ahead and take a couple steps forward and backwards. Okay, go ahead and sit back down. Okay. Next thing we're going to do is I'm going to go ahead and check your radial pulse. Okay, radial pulse is +2 bilaterally. If you could just go ahead and sit back down. I'm going to check your pedal pulse now. Okay, pedal pulse is also +2 bilaterally. I'm going to check the skin over. I don't see any lesions, abrasions, bumps, bruises, or rashes noted. I checked the bony prominences to see if there's any skin breakdown. I don't see any on the back of the elbows and the back of the ankle. Skin is warm and dry to touch. And I think that's all. Do you have any questions for me before the doctor?
No.
Okay, perfect. So the next thing I would do is perform hand hygiene, and I would go document my findings.